Hello, I'm Dr. Margaret Ames, and you're listening to Your Dental Health. The mission of my show is to get the word out about biomimetic dentistry. It's a major paradigm shift in dental care, and also for you to experience more comfortable, less invasive, and beautiful dentistry. I can be reached at my Huntington office at 631-261-4525 or on my website at drames@drames.com. Welcome to the show. If you're tuning in for the first time, I want to tell you a little bit about biomimetic dentistry. Biomimetic means mimics life. Biomimetic dentistry is tooth-conserving dentistry. Biomimetic dentistry treats weak, fractured, and decayed teeth in a way that keeps them strong and seals them from bacterial invasion. It reduces cutting teeth down for crowns and root canal treatments. In essence, it's utilizing the latest in dental materials and technology to preserve what we've got for as long as we've got it, just as nature intended. I had a great week this week. How about you? One of my star patients was a guy named Matt. He's a young guy. His sister referred him to the practice. He hadn't been to the dentist in years. He had decay between most of his molars, most of his back teeth, premolars, molars. And I didn't know where to start first. So, of course, he had cleaning so that there wouldn't be any bleeding of his gums when I'm treating him. And then I picked the deepest one because I said, we can save this from having a root canal. So we started on Wednesday, and I said, okay, gave him the Novocaine, went through all the steps. He was great. But at the end of the visit, it was perfect. I got great results. I was able to get all the decay out without going into the nerve. I mean, a root canal is not only invasive and takes away the blood supply to your tooth, but it also is a big investment. And root canals are good if you can't avoid it. But most people, if you don't have any symptoms, you want to come in and make sure that we get out the decay in a way that will preserve your tooth structure. 5 years ago, before I started doing this, there are many times when I would say, you know what, this is so deep, you're probably going to need a root canal in 6 months or a year, so we might as well do it now. That's no longer the case. Biomimetic dentistry has saved that. So why am I so passionate about it? Because patients deserve to have dentistry that rebuilds and restores rather than amputating healthy tooth structure. The science behind it is overwhelming. We can mimic natural teeth with new techniques and materials. Unfortunately, there's no formal specialty of this kind of dentistry to educate doctors in advanced technique. But because some of my mentors teaching these principles has become my passion, so I also lecture to dentists about this. Biomimetic dentistry is minimally invasive, it's conservative, it values the life of the tooth structure over the life of the restoration, and it's already becoming the sought-after treatment of choice among patients. People are driving miles. It's very complimentary, and it makes me feel so good about what I do. This week, a patient called from Vermont. She had moved to Florida. She goes to Vermont for the summer. And she called me. She said, I went to that dentist you told me about in Vermont 6 years ago, but I didn't, in Florida rather, but I didn't want anybody in Vermont that I didn't know touch me because I really, really trust you. So she called that morning, and she was down there. She drove down from Vermont to Long Island to get the tooth restored properly and conservatively so she wouldn't need a root canal. So the results of biomimetic dentistry is there's no mercury in your mouth, there's no tooth sensitivity, your mouth is more aesthetically pleasant or attractive, and your overall tooth anatomy is more like what the body expects. So less than a year ago, I was out at I was the president of the Academy of Biomimetic Dentistry. We started this organization so that we could get the word out to dentists all over the world. Nobody makes a lot of money on this. Nobody's backing us. So we dentists just had the passion. We started this up. We don't get paid for it. We're all volunteers. And we started the academy. So last year at the second annual meeting, we had a documentarian to come out and video the whole conference. We had to preserve this information because we have the leaders in tooth-conserving dentistry that came to the meeting. Last year it was in Reno, Nevada. This year it's in L.A., and the documentarian was there, and he filmed the whole conference, 3 days worth of material. Now, this is dentists, scientists, researchers talking to dentists. And the filmmaker said, at the end of the first night, he said, Dr. Ames, this is amazing stuff. This is really important. I have to go change dentists. I can't go to my old dentist anymore. He's from Mankato, Minnesota. So he does have family on the East Coast, and he's going to be making an appointment with me. But tonight we're going to talk to him because I want a layperson's view of really what biomimetic dentistry means. So, Ryan. Hi, Ryan.
Hi.
Welcome. How are you?
I'm good. How are you?
I'm good. I was just giving the listeners a background to how we met and that you're a documentarian and that you are, I didn't mention that you're now in the process of making a documentary for public television about biomimetic dentistry.
Well, I'm not sure if it'll be for public television or what the ultimate venue will be, but we're making it nonetheless, and we're going to try to get it out to the public as best we can. So
that's really exciting. In an earlier broadcast, I said the name of your company wrong. It's True Facade Pictures, not True Facade Video. Sorry about that, Ryan. Just wanted to clear that up. So I asked Ryan to join us today because he has some insights into biomimetic dentistry that not many patients get to understand. So welcome to the show.
Thank you. Glad to be here.
Great. How's the weather out there in Mankato?
It's actually beautiful.
Oh, nice.
It was a little hot earlier in the week, but pretty beautiful this week, or today anyway.
Great. So you came to the 2013 Academy of Biomimetic Dentistry Conference to video the proceedings. I believe you captured some 36 hours of lectures and interviews. But when we talked about it, you mentioned more than just the recording logistics. Would you please tell our audience more about our conversation?
Yeah, so I was invited to the ABD conference in 2013 in Reno, Nevada, basically just to film the lectures so that those dentists and people in that community would have the lectures to review after the conference is over. And in the process of doing this, I became significantly more and more intrigued about the content of these lectures, as well as the I guess the wide variety of experts that were there from so many different places across the world, really. Sharing the same passion about what I can only call advanced dentistry, advanced in their field, and entirely progressive dentistry compared to what I was used to, which is basic drill, fill, and bill dentistry. I mean, I think that's what most people experience. So anyway, it was fascinating. There were just a myriad of incredibly well educated and well-spoken professionals in different areas: dentistry, anthropology, history.
Well, let me ask you, Ryan, I know that what stands out for me most from the meeting was the great videos of Dr. Graham Milicic, who actually depicted the bending of the teeth. And I would think as a layperson, you might have been like, oh, wow, the teeth really bend. Like, what was we only have a couple minutes here for the first half of the show, but
sure.
What did you get about how the teeth are and why biomimetic dentistry is different?
Sure. So, I mean, I guess what happened to me when I was filming that is that I came to realize that the tooth is not, just a white rock that needs to be filled with things when it goes bad. That it's sort of like a living, breathing entity that needs to be, managed and taken care of as though it were a large architectural structure, so to speak. So you've got to have room for the wind to blow the skyscraper. And so, just this understanding of the tooth as a different thing than what I think most people look at it as. There are so many different layers and different tissue. And so in hearing these people and these experts talk about it, you could tell that there was a lot more that people needed to look at as far as how to treat a tooth, and looking at it as part of your entire medical system, I guess.
That's pretty profound. If you just tuned in, you're listening to Dr. Margaret Ames with Your Dental Health. I'm interviewing a documentarian, Ryan Sturgis from True Facade Pictures. You can reach me in my office at 631-261-4525. You can reach me on my website at drames.com, www.drames.com. After the break, we'll rejoin Ryan, and he'll continue to explain what biomimetic dentistry is to a layperson. So stay tuned. We'll be right back.
Whenever I see your smiling face, I have to smile myself because I love you.